Welcome to Equine Guelph's Research Radio, brought to you by SSG Gloves, a monthly look at the cutting-edge work being done at Equine Guelph. Today we're looking at biosecurity. What does it mean? Well, according to my guest, Dr. Steve Roche, it means a lot, especially to the health and competitiveness of our racehorses. That's all coming up on this week's edition of Research Radio, but first, SSG Gloves is also on the cutting edge. The SSG All-Weather is the most popular of all-weather gloves in the industry worldwide. Quality, durability, well, it wears like an iron and washes like a rag. Breathable, AquaSuede Plus Palm gives you a very good grip on the lines, wet or dry. And the elasticized back gives a cool, comfortable fit. The SSG All-Weather. See your local SSG dealer. For more info, go to ssgridinggloves.com. Dr. Steven Roche, welcome to Research Radio.
Thanks very much. Thanks for having me.
Let's talk about the biosecurity program as a whole. It sounds like something extremely high-tech, like something out of a movie, but it's really some basic common sense measures that horse people can take, especially in the racing industry, to make sure their horses stay healthy and competitive.
That's exactly right, Norm. Yeah, it does sound like a little bit high level, and there's a lot of comments about biosecurity sounding like a very invasive word, and people tend to think of hazmat suits and gloves and all the protective gear that comes with it, and generally the vision of a lab comes to mind. But it's really much more about preventing disease from coming on the farm, and when there are bacteria or viruses present on the farm, how do we control that and make sure that we can limit the impact of those bugs, as I'll call them, and preventing disease from animals in the first place.
Well, you point out that disease costs you as a horse owner. Let's talk about that.
Yeah, so frankly, disease, especially in the racing world, is going to result in missed racing days. So at the end of the day, if your horse isn't able to race, you're not going to be able to bring home much, if any, money at all, right? So it costs you from that perspective. Bottom line, I suppose, is the best way to put that. It's also going to cost money in terms of just treatment of the horse, right? These horses are prized possessions, not just emotionally. We have a lot invested in them, but we have a lot invested in them financially. So it's important that we want to make sure that they're treated and kept healthy at all times. So disease is going to cost us from that standpoint too. And I will maybe belabor that point a little bit too about the emotional stress, the cost that comes with that. It's not easy to have horses that can't race, not just from, again, the bottom line perspective, but, you want to treat these animals as good as you can. We care about them. There are parts of our family, and we want to make sure that they're in top condition, not just for racing, but to be happy and healthy in general.
That's why one of the key mottos of the program is spread the word, not the germs. Prevention is a big key factor, and focusing on what you can control. Let's talk about that.
Absolutely. Well, biosecurity, or probably more appropriately called infection control on the farm, is really all about prevention in the first go. So we want to prevent things from coming on the farm in the first kind of go through. And if we can do that, then we really don't have to worry too much about controlling things, right? Because we're preventing them from coming on the farm or into the facility in the first place. So some of the big things here to first think about, what are we dealing with? Are we dealing with viruses like the flu or equine herpes, or are we dealing with bacteria like things like that cause things like strangles? So different approaches to prevention, whether it be just making sure that we're segregating or separating new introductions, so horses we're buying at auction, whether they be young or old, separating them and preventing them from contacting or spreading anything that they might have into the normal population of horses, whether that you're at a training center or just at home in your own barn. It's important to make sure that we take these measures in order to prevent the introduction of disease in the first place.
One of the things that pops out is some very basic common sense things, but when you work in a barn, your hands get dirty, your boots and clothes get dirty. You're advocating, however, that there are certain things you can do to keep yourself cleaner in the barn and avoid the spread of germs.
Absolutely. So no question at all, the barn is a dirty environment. Everyone likes to get their their hands and feet dirty as part of this job, so not surprising there. And we're not advocating that this needs to be a sterile environment. And again, just to make that point clear, that biosecurity sometimes rings true for sterility and everything being clean, and that's really not the farm environment that we're talking about here. And that's why we tend to use more of that infection control terminology. And that comes right into keeping your hands, clothes, and boots clean. And one of the most important things there is to make sure that you're not touching the mucus areas of the horse when you have dirty hands, because that's really the areas that germs are going to want to get in and start causing infection or disease. So washing your hands before touching the nose, mouth, eyes area of the horse is going to be an easy one to do, and washing your hands, whether it be with hot soapy water or using an alcohol-based hand sanitizer after the fact, can be a really useful way to do that. Again, like you say, very common sense stuff, so nothing too surprising there. Perhaps the more important thing here, and it goes along with that separation of animals, is when you've got different animals with different levels of risk. And what I mean by that is maybe you've got some horses that are staying at home and almost always at home, where you've got some others that are traveling to shows, they're going to tracks, they're traveling around, they're being exposed to different things. And as a result, those groups of horses represent different levels of risk in terms of disease. And so what we tend to say is try and keep the equipment as well as yourself, so your hands, clothes, and boots clean, and use different tools when you're actually working with these various animals. So if I'm going from one group of animals with one level of risk to another group of animals that have a different level of risk with respect to disease, I want to make sure that I wash my boots, change my clothes if that's possible, or at least wash my hands before interacting with that new group of horses, certainly to make sure that I'm not going to be transferring anything over.
Now, you point out something that's very interesting. You say that we should be selfish at the track. What does that mean?
Absolutely. Well, the track is a kind of a perfect melting pot for or opportunity for the transmission of disease. And what I mean by that is you've got a large number of animals that are generally at some level of stress, certainly more stressed than they are when they're simply at home in their normal environment. And that's because of the travel that they're going to go through, as well as an exciting time for horses, right? They're getting excited, they're ready to race, and so they're starting to get a little more stressed in terms of their bodies. Now, they're commingling in areas where they're sharing the same airspace, they're sharing relatively tight quarters, right? Everyone's got their own stall, but they're commingling here, and there's a lot of opportunity for disease to be transmitted, or bacteria and viruses to be transmitted, whether it be through the air or on the hands or equipment that's being used. And so the important kind of note about being selfish here is really to just take that opportunity to say, you know what, I'm going to use my equipment, I'm going to bring my own equipment to the track, and I'm going to use that strictly for my horse. It's not because I don't want to share with others, it's strictly because I don't want to have my horse be infected with anything, nor do I want anything my horse might have be to cause any problems for another person's horse. So it's kind of an interesting sentiment. Be selfish from the perspective of disease control, and you're likely to be better off.
You have a number of partners that have come on board, everybody from COSA, Equine Canada, Grand River. The folks over there have gotten involved in this. Tell us about some of those groups.
Absolutely. We've had a tremendous number of partners work with us on this initiative. It's really been overwhelming the number of stakeholders we've been able to engage, and really pleased to be able to say that we've gone from everywhere from provincial and federal groups in the government all the way through to private organizations. The Ontario Racing Commission was a big partner with us. We worked quite a bit with them, getting involved in training centers and working with the racing officials themselves to educate them on some of the biosecurity or infection control practices that we like to see on farm, and that they can actually take part in when they're going out for investigations, as well as being part of the track or training center atmosphere. We're working with educational institutions like the University of Guelph and Ontario Veterinary College, a number of associations. We couldn't do any of this work without the work with quarter horse, standardbred, and thoroughbred groups, and we're really pleased to say we've engaged a number of partners involved in them, and a number of other organizations, and frankly, there's been so many here that it's starting to be difficult to keep track, but it's been a lot of fun and a very much collaborative effort.
Well, we'll keep spreading the word and not the germs, and it sounds like some very good work you're doing. Thank you for joining us on Research Radio, Doctor.
Thanks, Norm. Thanks for having me.